What to eat when you have chronic hepatitis? The goal of a hepatitis diet is to minimize stress on your liver, which is already compromised by the inflammation that defines the condition. Perhaps surprisingly, an ideal eating plan for chronic hepatitis is simply one that aligns with healthy eating guidelines for all adults provided by the U.S. Department of Agriculture, USDA. A nutritious diet can help you maintain an optimal weight and may help you to preserve healthy liver function. While you may need to adjust your diet based on your specific diagnosis, the guiding principles of basic nutrition are likely to give your body what it needs without further taxing your liver. Benefits: when hepatitis, of which there are several types, persists for longer than 6 months, it is deemed chronic. Symptoms may not develop until the condition becomes more severe, usually when liver damage has already begun. Diet can support the liver and help manage symptoms of hepatitis. Constant fatigue is the most common one. Others include diarrhea, joint pain, and trouble eating full meals. Research has demonstrated that malnutrition and loss of muscle mass become more common as the condition progresses. Some people also have a difficult time maintaining a healthy weight. Following the eating guidelines recommended by nutritional experts and endorsed by the USDA will help you to sustain energy levels throughout the day, maintain muscle mass, and keep your body at a healthy weight. You can tweak your plan as needed to manage symptoms such as stomach discomfort as they arise. How it works: the 2015 to 2020 dietary guidelines emphasize eating a wide variety of nutrient-dense foods, that is, those that provide great nutritional value and few calories. People are also encouraged to develop an overall pattern of healthy eating rather than focusing on single food groups. By nature of it being a regular plan for healthy eating, a hepatitis diet is rather straightforward. That said, if following it means a drastic change in your previous eating habits, adjusting to it like any other diet will take some time and effort. Duration: since eating for chronic hepatitis is no different than eating for optimal health, it's important to think about adopting the healthy eating pattern for life. Even if you don't experience hepatitis symptoms or issues like loss of muscle mass or malnutrition, a healthy diet will help you improve your wellness and prevent other chronic diseases, such as heart disease and diabetes. What to eat: compliant foods, vegetables, fruits, grains, protein foods, coffee. Healthy fats: non-compliant foods, saturated fat, trans fat, excess sodium, excess sugar, excess iron, alcohol. Fruits and vegetables: fruits and vegetables provide your body with vitamins and minerals important for a healthy body. Consuming these fiber-rich foods may also help you decrease your intake of less healthy foods, such as fatty meats or sugary treats, as they are quite filling. Consumption of leafy green vegetables, in particular, may provide benefits to those managing hepatitis. Studies have shown that these can lessen the fatty acid composition in your liver. Grains: foods in the grain category include bread, pasta, rice, and oats. Dietary guidelines suggest that at least half of the grains you consume be whole grains, rather than refined grains, such as white bread, white rice, or white pasta. Whole grains help boost your protein intake, which can help you to maintain muscle mass. Protein foods: consuming the right amount of protein is important when you have chronic hepatitis. Eating enough protein can help you to avoid malnutrition and muscle wasting, but consuming too much protein can lead to complications, including a condition known as encephalopathy. Lentils, beans, nuts, and tofu are all good sources of protein. Coffee: studies have shown that drinking a caffeinated beverage like coffee reduces the risk for advanced liver scarring in people with chronic hepatitis. So far, evidence suggests that consuming 2 large cups of coffee, or about 100 milligrams (mg) of caffeine, is associated with a significant reduction in advanced scarring. This seems to be beneficial with drip coffee, but not espresso. Healthy fats: dietary guidelines advise that you consume less than 10% of calories per day from saturated fats and eliminate trans fats completely. They suggest that you replace both of these with healthier fats. Saturated fats are found in red meat and full-fat dairy products. Healthy plant-based fats such as olive, sunflower, or avocado oils provide polyunsaturated and monounsaturated fatty acids that are associated with health benefits, including a reduced risk for heart disease. However, all fats and oils should be consumed in moderation. Excess salt. If chronic hepatitis progresses to liver cirrhosis, there can be an accumulation of fluid in the abdomen, a condition called ascites. People with ascites should restrict their sodium intake to 2,000 mg per day. Excess sugar. People with hepatitis should be especially careful to consume sugar in moderation. Studies have shown that hepatitis is associated with an increased risk of diabetes. Reducing your intake of added sugar can help to decrease this risk. Alcohol. Alcohol consumption causes increased stress on your liver and can put you at higher risk for liver damage. If you have chronic hepatitis, experts advise that you avoid alcohol. There is no specific meal timing pattern recommended for those with chronic hepatitis, but many people with the condition prefer to consume small frequent meals rather than 2 to 3 large meals each day to maintain energy levels. One of the jobs of the liver is to store glycogen, which is used by the body for immediate energy. Most people can store relatively large amounts of glycogen in their livers, but when the liver is damaged, scar tissue takes away valuable storage space. As a result, the liver can't store as much glycogen as it once could. Consuming small, frequent meals, making sure to include carbohydrates, allows your body the chance to replace its glycogen reserves on a steady basis.